Medical Assistant Exam Order of Draw Questions. Question 1. Following office protocol in an exam room, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Improved privacy protection. Option B. Better sterilization monitoring. Option C. Automatic insurance approval. Option D. Loss of accountability for chart access. The correct answer is option D. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Question 2. In a clinical skills review, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Give a diagnosis over the phone. Option B. Schedule the patient for next month. Option C. Follow emergency triage protocol immediately. Option D. Tell the patient to send an email later. The correct answer is option C. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Potential emergencies require immediate action. Question 3. In an urgent care office, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Continue if the last name matches. Option B. Stop and resolve the discrepancy before proceeding with care. Option C. Use the appointment time as the identifier. Option D. Correct the date of birth without asking anyone. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. A last name alone does not rule out an identity error. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. Question 4. Given the workflow in a pediatric clinic, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Inflammation of the liver. Option B. Slow heart rate. Option C. Fast breathing. Option D. High blood sugar. The correct answer is option B. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Question 5. When a patient encounter unfolds in a medical office workflow, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask the patient to state 2 identifiers and compare them with the order. Option B. Use the room number because it is faster. Option C. Label the tube after returning to the lab. Option D. Ask a family member to confirm the name only. The correct answer is option A. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A family member may be mistaken and one identifier is not enough for positive identification. Question 6. A medical assistant is working in a treatment room when the term hypertension appears in the problem list. Which meaning is correct? Option A. Slow breathing. Option B. Low blood glucose. Option C. Joint inflammation. Option D. High blood pressure. The correct answer is option D. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Question 7. In a quality control review, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Leave it because both patients use the same clinic. Option B. Report and correct the filing error according to policy. Option C. Ask the patient to sign a blank form. Option D. Delete the form and tell no one. The correct answer is option B. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy. so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Blank forms do not correct the misfiled record and are inappropriate. Unreported deletion can worsen the documentation error. Question 8. At the start of care in a quality control review, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A, pulmonary artery. Option B, pulmonary vein. Option C, superior vena cava. Option D, aorta. The correct answer is option A, pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The superior vena cava returns venous blood to the right atrium. The aorta carries oxygenated blood from the left ventricle to the body. Question 9. An office review in a busy front office shows that a patient asks for a copy of their medical record. Which action should the assistant take? Option A, follow the office release of information process. Option B, delete sensitive information before the request is reviewed. Option C, refuse because records belong only to the provider. Option D, give the record to anyone who asks. The correct answer is option A, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 10. For a patient encounter in a busy front office, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, light blue tube. Option B, blood culture bottle. Option C, gray tube. Option D, lavender tube. The correct answer is option C, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Light blue citrate is used for coagulation studies. Blood culture bottles are used to detect bloodstream microorganisms. Lavender EDTA is used mainly for hematology testing. Question 11. During a clinical skills review, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, include unrelated patient charts in the same fax. Option B, send it to a number from memory without checking. Option C, verify the recipient fax number before sending. Option D, leave the fax confirmation on a public counter. The correct answer is option C, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Memory errors can lead to misdirected protected information. Confirmation pages may contain protected information and should be handled securely. Question 12. The care team in an urgent care office asks for guidance because the term dermatology appears in a referral. Which specialty is involved? Option A, blood. Option B, skin. Option C, kidney. Option D, heart. The correct answer is option B, skin. Dermatology is the specialty focused on skin conditions. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Cardiology focuses on the heart. Question 13. After reviewing the situation in a certification exam scenario, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, document that the patient requested it and proceed. Option B, perform it because any provider request is automatically legal. Option C, clarify the concern and follow legal scope of practice requirements. Option D, ask another assistant to do it secretly. The correct answer is option C, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 14. Given the workflow in a quality control review, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, place the probe over wet nail polish. Option B, increase oxygen without reporting the finding. Option C, warm the finger or choose a better perfused site. Option D, ignore the waveform and record the lowest value. The correct answer is option C, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. Medication or oxygen changes should follow provider direction and clinical protocol. An unstable signal should be corrected before documenting the value. Question 15. After reviewing the situation in a women's health clinic, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, lithotomy position. Option B, Fowler position. Option C, Trendelenburg as the only routine choice. Option D, prone position. The correct answer is option B, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Prone places the patient face down and may worsen breathing comfort. Question 16. During a pediatric clinic, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, place sterile gauze on an unclean counter. Option B, reuse sterile gloves from a previous patient. Option C, open sterile supplies without touching the inner sterile surface. Option D, reach across the field with unsterile clothing. The correct answer is option C, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 17. At the start of care in a patient intake station, the suffix itis appears in a medical term. Which meaning is most accurate? Option A, pain. Option B, removal. Option C, inflammation. Option D, study of. The correct answer is option C, inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 18. A medical assistant is working in an outpatient laboratory when an intradermal test is being prepared. Which description matches the route? Option A, injection into deep muscle tissue. Option B, injection just under the epidermis to form a small wheal. Option C, medication placed into the ear canal. Option D, medication swallowed by mouth. The correct answer is option B, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Ear canal administration is otic. Swallowed medication is oral administration. Question 19. The care team in a medication administration visit asks for guidance because a medication is labeled for otic use. Where should it be administered? Option A, eye. Option B, mouth. Option C, ear. Option D, nose. The correct answer is option C, ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 20. For a patient encounter in a treatment room, a prothrombin time test is ordered. Which tube should be selected? Option A, gray tube. Option B, lavender tube. Option C, blood culture bottle only. Option D, light blue tube. The correct answer is option D, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluoride oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 21. Given the workflow in a same-day appointment, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, clean and dry the skin before applying electrodes. Option B, use tape only and skip electrodes. Option C, move all chest leads to the abdomen. Option D, apply electrodes directly over lotion. The correct answer is option A, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Question 22. For a patient encounter in a walk-in clinic, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, premium. Option B, copayment. Option C, adjustment. Option D, deductible. The correct answer is option B, copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 23. At the start of care in a preventive care visit, a patient asks for printed medication instructions. Which practice improves health literacy? Option A, use clear language and review the key points with the patient. Option B, use only complex medical terminology. Option C, provide instructions in the wrong language. Option D, tell the patient to search online without guidance. The correct answer is option A, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Complex terms can reduce comprehension. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Question 24. In a patient education session, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, shout from another room. Option B, assume the patient cannot participate. Option C, face the patient and speak clearly at a moderate pace. Option D, cover the mouth while speaking. The correct answer is option C, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Shouting from a distance reduces clarity and privacy. Hearing difficulty does not mean the patient cannot understand or decide. Covering the mouth removes visual cues. Question 25. The care team in a diagnostic testing area asks for guidance because a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, stand over the patient with crossed arms. Option B, keep checking messages during the conversation. Option C, laugh to lighten the mood immediately. Option D, sit at eye level and allow silence when appropriate. The correct answer is option D, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Closed posture and standing over the patient can seem intimidating. Distracted behavior suggests the patient is not being heard. Humor can be inappropriate when a patient is distressed. Question 26. Following office protocol in a busy front office, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, ask a young child to interpret. Option B, speak louder and slower in English only. Option C, skip the explanation if the patient nods. Option D, use a qualified medical interpreter. The correct answer is option D, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Volume does not remove a language barrier. Nodding does not prove understanding or valid communication. Question 27. After reviewing the situation in a clinical skills review, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, shake the tube forcefully. Option B, open the tube and stir with a swab. Option C, gently invert the tube the required number of times. Option D, leave the tube unmixed until pickup. The correct answer is option C, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Question 28. Following office protocol in a primary care office, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, deep into the deltoid muscle only. Option B, abdomen with adequate subcutaneous tissue. Option C, into an area that is bruised and inflamed. Option D, directly into a vein. The correct answer is option B, Abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Intravenous administration is a different route and is outside a subcutaneous injection. Question 29. An office review in an outpatient laboratory shows that an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, respondeat superior. Option B, abandonment. Option C, beneficence. Option D, patient autonomy. The correct answer is option D, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Question 30. When a patient encounter unfolds in a phlebotomy station, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, ophthalmoscope. Option B, centrifuge. Option C, otoscope. Option D, reflex hammer. The correct answer is option A, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. Question 31. At the start of care in a medical office workflow, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A, the side of the middle or ring finger pad. Option B, the tip of the index finger. Option C, the center of the thumb pad. Option D, the little finger near the bone. The correct answer is option A, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. Question 32. When a patient encounter unfolds in a patient education session, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, platelet. Option B, ureter. Option C, axon. Option D, alveolus. The correct answer is option C, axon. An axon carries nerve impulses away from the neuron cell body. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 33. A medical assistant is working in an infection control audit when the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, insulin. Option C, estrogen. Option D, melatonin. The correct answer is option B, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Melatonin is associated with sleep-wake cycles. Question 34. To protect safety in a telephone triage workflow, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, review the provider-approved instructions and confirm understanding. Option B, create new instructions that contradict the provider. Option C, tell the patient not to call if symptoms worsen. Option D, avoid documenting that instructions were given. The correct answer is option A, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teachback to verify understanding. Instructions should match the provider's plan and office protocol. Patients should know when and how to seek help for concerning symptoms. Patient education should be documented according to policy. Question 35. When a patient encounter unfolds in a certification exam scenario, the assistant is comparing two needle gauges. Which statement is accurate? Option A, a smaller gauge number indicates a larger needle diameter. Option B, all injections use the same gauge. Option C, a larger gauge number always means a longer needle. Option D, gauge has no relation to needle size. The correct answer is option A. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge describes diameter, not length. Gauge specifically describes needle diameter. Question 36. After reviewing the situation in a specialty referral visit, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, gray fluoride tube for all serum tests. Option B, light blue citrate tube for serum. Option C, a red or gold serum tube. Option D, lavender EDTA tube for serum. The correct answer is option C, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. EDTA prevents clotting and produces whole blood or plasma, not serum. Question 37. At the start of care in a busy front office, a patient makes a complaint about care received in the office. Which response is most professional? Option A, post the complaint online for staff opinions. Option B, argue until the patient stops complaining. Option C, listen respectfully and follow the office complaint process. Option D, delete documentation related to the complaint. The correct answer is option C, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Question 38. An office review in a treatment room shows that the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, write your normal after exam. Option B, ear infection diagnosed today. Option C, patient reports sharp right ear pain for 2 days. Option D, patient seems dramatic about ear pain. The correct answer is option C, patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Question 39. Following office protocol in a patient education session, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, ignore the medication order completely without communication. Option B, interpret the abbreviation however it seems most likely. Option C, ask another patient what the abbreviation means. Option D, clarify the order before proceeding. The correct answer is option D, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 40. The care team in a quality control review asks for guidance because a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, prone. Option C, supine. Option D, lithotomy. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 41. Following office protocol in an infection control audit, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, deltoid muscle when the medication and volume are appropriate. Option B, a reddened rash site. Option C, the fingernail bed. Option D, inside a visible vein. The correct answer is option A, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. Irritated or infected skin should generally be avoided. The fingernail bed is not an intramuscular injection site. A vein is used for intravenous access, not intramuscular injection. Question 42. After reviewing the situation in a community health clinic, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, gallbladder. Option B, alveolus. Option C, ureter. Option D, sinoatrial node. The correct answer is option D, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. Question 43. After reviewing the situation in a same-day appointment, a patient asks which body system includes the skin. Which system should be identified? Option A, integumentary system. Option B, urinary system. Option C, respiratory system. Option D, endocrine system. The correct answer is option A, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. The endocrine system is made of hormone-producing glands. Question 44. During an infection control audit, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A, follow facility policy and do not use it if safety cannot be verified. Option B, guess the opening date from memory. Option C, use it because the cap is still attached. Option D, mix it with another vial to avoid waste. The correct answer is option A, follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. The cap does not prove when the vial was opened or whether it was stored correctly. Combining vials can contaminate medication and is not appropriate. Question 45. To protect safety in a phlebotomy station, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, use latex-free supplies and clearly communicate the allergy. Option B, use powdered latex gloves because they are easier to put on. Option C, tell the patient to bring personal gloves only. Option D, ignore the allergy if the procedure is short. The correct answer is option A, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Question 46. Before the visit continues in a walk-in clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, tell the patient the practice is foolish. Option B, assume all people from that culture act the same. Option C, refuse to document relevant information. Option D, ask respectful questions and avoid judgment. The correct answer is option D, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Question 47. As part of exam preparation in a busy front office, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, state the full diagnosis loudly to confirm the visit. Option B, speak quietly and avoid announcing sensitive details. Option C, ask other patients to help verify the record. Option D, place all charts open on the counter. The correct answer is option B, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Open charts may expose protected information. Question 48. Before the visit continues in a telephone triage workflow, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, clean catch midstream specimen. Option B, first drops of urine into an unclean container. Option C, a random sample from an old urinal. Option D, specimen collected from the toilet bowl. The correct answer is option A, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Question 49. During a same-day appointment, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A, lavender EDTA tube. Option B, light blue sodium citrate tube. Option C, green heparin tube. Option D, gray fluoride oxalate tube. The correct answer is option B, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Gray tubes are generally collected near the end of the order. Question 50. For a patient encounter in a quality control review, the term tachypnea appears on an intake form. Which meaning is correct? Option A, painful urination. Option B, slow pulse. Option C, low temperature. Option D, rapid breathing. The correct answer is option D, rapid breathing. Tachy means fast, and nea relates to breathing. Painful urination is dysuria. Slow pulse is bradycardia. Low temperature is hypothermia. Question 51. Following office protocol in a busy front office, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, record readings with date, time, and relevant notes as directed. Option B, skip technique instructions because home cuffs are automatic. Option C, write only the highest number ever measured. Option D, use another person's readings if the cuff is shared. The correct answer is option A, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Readings must belong to the patient. Question 52. A medical assistant is working in an exam room when a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, switch to a rectal temperature without asking. Option B, record the temperature as normal without measuring it. Option C, take the temperature immediately because oral readings are unaffected. Option D, await according to office protocol before measuring the oral temperature. The correct answer is option D, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Question 53. A medical assistant is working in an administrative check-in area when the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count for 5 seconds and multiply by 12. Option B, count respirations while the patient is unaware of the measurement. Option C, record the respiratory rate from the last visit. Option D, ask the patient to breathe as deeply as possible. The correct answer is option B, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 54. A medical assistant is working in a preventive care visit when a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, complete all paperwork before telling anyone. Option B, tell the patient it is probably anxiety. Option C, notify the provider immediately and follow emergency protocol. Option D, ask the patient to drive to another clinic. The correct answer is option C, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Potential cardiac symptoms should be handled through established emergency procedures. Question 55. At the start of care in a certification exam scenario, a provider orders spirometry in the office. Which patient action is required? Option A, talk continuously during the maneuver. Option B, hold both nostrils and refuse to exhale. Option C, follow instructions for a strong, complete breathing maneuver. Option D, remove the mouthpiece before starting. The correct answer is option C, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Question 56. As part of exam preparation in a certification exam scenario, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A, patient states, I have had a cough for 3 days. Option B, patient is definitely exaggerating the cough. Option C, no documentation is needed for symptoms. Option D, the assistant diagnoses pneumonia. The correct answer is option A, patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Judgmental wording is inappropriate and not objective. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Question 57. Given the workflow in a walk-in clinic, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, change the patient's diagnosis to match the meter. Option C, use the meter because patient samples are different. Option D, resolve the quality control problem according to protocol. The correct answer is option D, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 58. In a diagnostic testing area, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, use the defibrillator on a conscious patient asking questions. Option B, wait for the provider before starting any response. Option C, give oral medication before checking responsiveness. Option D, begin CPR and use the automated external defibrillator as directed. The correct answer is option D, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 59. When a patient encounter unfolds in a cardiology practice, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, appointment reminder template. Option B, insurance remittance advice. Option C, safety data sheet. Option D, patient intake form. The correct answer is option C, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Question 60. A medical assistant is working in an internal medicine office when a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, round weight to the nearest 10 pounds. Option C, record height only because weight changes often. Option D, record the measurements using the unit required by the office protocol. The correct answer is option D, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Question 61. An office review in a cardiology practice shows that a chain of custody urine drug screen is collected. Which practice is most important? Option A, skip signatures if the specimen looks normal. Option B, allow the patient to take the specimen home first. Option C, document each transfer and maintain specimen integrity. Option D, use an unlabeled container until the lab receives it. The correct answer is option C, document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 62. At the start of care in an exam room, a specimen label is missing after collection. Which action is best? Option A, write a name on the tube from memory. Option B, send the tube with no label and explain later. Option C, ask another patient if the tube belongs to them. Option D, follow facility policy for recollection or correction without guessing. The correct answer is option D, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Question 63. While working in an administrative check-in area, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, wrap the specimen in foil or use an amber container as directed. Option B, leave the specimen uncovered at the front desk. Option C, shake the specimen vigorously for 1 minute. Option D, place the tube in direct sunlight to warm it. The correct answer is option A. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Sunlight can degrade light-sensitive specimens. Question 64. An office review in a community health clinic shows that the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, immediately. Option B, every morning. Option C, as needed. Option D, by mouth. The correct answer is option C, as needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Question 65. To protect safety in a medical office workflow, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, ask the patient to rate pain using the office's standard scale. Option C, change the score to match the assistant's opinion. Option D, tell the patient pain is not part of vital signs. The correct answer is option B. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 66. A medical assistant is working in a family practice clinic when a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, leave the patient standing while searching for forms. Option B, ask the patient to walk faster. Option C, tell the patient dizziness is impossible. Option D, assist the patient to sit or lie down safely. The correct answer is option D, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. Question 67. For a patient encounter in a cardiology practice, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, hide supplies from the provider. Option B, track usage and adjust par levels according to office needs. Option C, wait until every item is completely gone. Option D, order random supplies without reviewing use. The correct answer is option B, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Question 68. Given the workflow in a medication administration visit, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Gently adjust the needle position while maintaining safety. Option B. Label the empty tube as collected. Option C. Remove the tourniquet and continue filling all tubes. Option D. Probe aggressively until blood returns. The correct answer is option A. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. Question 69. After reviewing the situation in a primary care office, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ignore the error even if it affects care. Option B. Make an addendum according to office policy. Option C. Ask a coworker to change it under their login. Option D. Delete the original note completely. The correct answer is option B. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Question 70. As part of exam preparation in a walk-in clinic, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Suture removal scissors or sterile scissors according to policy. Option B. Tuning fork only. Option C. Ophthalmoscope only. Option D. Peak flow meter only. The correct answer is option A. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. An ophthalmoscope is used to examine the eye, not remove sutures. A peak flow meter measures expiratory airflow and does not remove sutures. Question 71. A medical assistant is working in an electronic health record review when an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, IM. Option B, 4. Option C, subcut. Option D, PA. The correct answer is option D, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 72. Following office protocol in a medication administration visit, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, speculum for pelvic exam. Option B, otoscope. Option C, ophthalmoscope. Option D, spirometer. The correct answer is option B, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. Question 73. In a patient education session, the provider is running behind and a patient asks for an update. Which response is professional? Option A, apologize for the delay and provide the best available estimate. Option B, discuss another patient's emergency as the reason. Option C, tell the patient that waiting is their only option. Option D, guarantee an exact time even when it is unknown. The correct answer is option A, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Sharing another patient's situation can violate privacy. Dismissive communication is unprofessional. False certainty can create more frustration. Question 74. The care team in a pediatric clinic asks for guidance because a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, activate emergency response and assess breathing according to training. Option B, finish documenting the previous visit. Option C, move the patient to a chair before assessing. Option D, offer water by mouth immediately. The correct answer is option A, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 75. The care team in a patient education session asks for guidance because the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Before. Option B. Against. Option C. Above normal. Option D. Below normal or deficient. The correct answer is option D. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Before is indicated by pre. Against is indicated by anti. Above normal is indicated by hyper. Question 76. Given the workflow in a patient education session, a complete blood count is ordered. Which tube is most commonly used? Option A. Gray tube with fluoride oxalate. Option B. Lavender tube with EDTA. Option C. Red tube with no anticoagulant. Option D. Light blue tube with sodium citrate. The correct answer is option B. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Question 77. The care team in an urgent care office asks for guidance because the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Liver. Option C. Stomach. Option D. Kidney. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Liver inflammation is hepatitis. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis. Question 78. Before the visit continues in a treatment room, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Sterile technique. Option B. Patient confidentiality. Option C. Chain of custody. Option D. Prior authorization. The correct answer is option B. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services. Question 79. To protect safety in a preventive care visit, a rapid strep test requires a throat swab. Which technique is best? Option A. Touch the tongue repeatedly to collect saliva. Option B. Swab the outside of the lips. Option C. Collect sputum from a deep cough. Option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. The correct answer is option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Question 80. The care team in an administrative check-in area asks for guidance because a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Advance directive. Option B. Sterilization log. Option C. Explanation of benefits. Option D. Progress note. The correct answer is option C. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. Question 81. Given the workflow in a women's health clinic, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Assault. Option B. Abandonment. Option C. Coinsurance. Option D. Beneficence. The correct answer is option B. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Co-insurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Question 82. To protect safety in a busy front office, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Allow the alcohol to dry completely. Option B. Blow on the site to speed drying. Option C. Touch the vein again with an ungloved finger. Option D. Draw blood while alcohol is still wet. The correct answer is option A. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Question 83. To protect safety in a patient intake station, a mask becomes wet during patient care. Which action is appropriate? Option A. Keep wearing it for the rest of the week. Option B. Share it with a coworker. Option C. Dry it on the clean supply shelf. Option D. Replace the mask according to infection control practice. The correct answer is option D. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Extended use of a wet mask is not appropriate. Masks are not shared between staff. Used masks can contaminate clean areas. Question 84. At the start of care in a procedure setup, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Give instructions as quickly as possible. Option B. Ask only whether the patient has any questions. Option C. Use medical jargon to sound professional. Option D. Ask the patient to explain the instructions back in their own words. The correct answer is option D. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Patients may say no even when they misunderstand instructions. Jargon can confuse patients and reduce understanding. Question 85. When a patient encounter unfolds in an urgent care office, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Ask the patient to jump to the table. Option B. Pull the patient by the arms quickly. Option C. Leave the wheelchair unlocked for easier movement. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Question 86. During a phlebotomy station, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A. Leave the container unrefrigerated unless it smells unusual. Option B. Discard the first void and collect all urine for the next 24 hours. Option C. Keep only the first void and discard the rest. Option D. Collect urine only when symptoms occur. The correct answer is option B. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Question 87. To protect safety in a phlebotomy station, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should fit properly and not press into the axilla. Option B. The patient should skip follow-up if pain increases. Option C. Crutches should be used only on wet floors. Option D. Body weight should rest mainly on the armpits. The correct answer is option A. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 88. In a busy front office, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, tighten it further until the vein bulges. Option B, release it and allow the arm to recover before continuing. Option C, move it over the venipuncture site. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option B. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. More pressure can increase discomfort and alter specimen quality. A tourniquet is placed above the site, not over the puncture area. Tourniquet time can affect certain laboratory values. Question 89. After reviewing the situation in a medication administration visit, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 4th intercostal space at the right sternal border. Option B, 5th intercostal space at the left midclavicular line. Option C, 4th intercostal space at the left sternal border. Option D, a midway between V2 and V4. The correct answer is option B, 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V1. That location is used for V2. That location is used for V3 rather than V4. Question 90. An office review in an administrative check-in area shows that the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, ventricular depolarization. Option B, atrial repolarization only as the visible main event. Option C, ventricular filling with blood only. Option D, a lung gas exchange. The correct answer is option A, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Atrial repolarization is usually hidden within the QRS complex. Mechanical filling is not the primary electrical event represented by QRS. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 91. For a patient encounter in a diagnostic testing area, a patient falls in the exam room. Which action is best? Option A, tell the patient to drive home without evaluation. Option B, call for help and assess for injury before moving the patient. Option C, hide the incident if no one saw it. Option D, pull the patient up immediately. The correct answer is option B, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 92. Following office protocol in a medication administration visit, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A, give medication first and ask about allergies later. Option B, ignore the band if the patient seems healthy. Option C, verify the allergy information in the record and with the patient. Option D, remove the band so it does not worry the patient. The correct answer is option C, verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergies must be checked before administration. Allergy risk is not based on appearance. Removing an alert without direction can create risk. Question 93. During an infection control audit, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, gray tube. Option B, green tube. Option C, lavender tube. Option D, light blue tube. The correct answer is option B, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Question 94. To protect safety in an outpatient laboratory, a claim requires the code that explains why a service was performed. Which code set is used? Option A, place of service only. Option B, CPT. Option C, NDC only. Option D, ICD-10-CM. The correct answer is option D, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. Place of service identifies setting, not the medical reason for care. CPT codes report procedures and services rather than diagnoses. National drug codes identify medications and do not describe diagnoses. Question 95. At the start of care in an exam room, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Recheck using proper technique and report the finding according to protocol. Option B. Erase the value because it may worry the patient. Option C. Tell the patient that hypertension has been diagnosed. Option D. Send the patient home to rest without notifying anyone. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 96. An office review in a clinical skills review shows that a patient feels faint during a blood draw. Which response should occur first? Option A. Finish filling the tube before responding. Option B. Leave the patient alone to find paperwork. Option C. Tell the patient to stand up quickly. Option D. Stop the procedure and protect the patient from injury. The correct answer is option D. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Continuing the draw can worsen the situation and increase injury risk. A faint patient should not be left unattended. Standing can worsen faintness and lead to a fall. Question 97. A medical assistant is working in an internal medicine office when a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Deny the request because there is no job-related need to know. Option B. Print the chart and remove the patient's name only. Option C. Share the chart because staff work in the same clinic. Option D. Open the chart if the coworker promises not to tell anyone. The correct answer is option A. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. De-identified information must meet specific standards and curiosity is not permitted access. Employment at the same clinic does not automatically authorize chart access. A promise does not create a permitted reason for access. Question 98. An office review in a diagnostic testing area shows that a tickler file is used in the office. Which purpose does it serve? Option A. Draw blood into tubes. Option B. Track future follow-ups or reminders. Option C. Measure oxygen saturation. Option D. Sterilize instruments. The correct answer is option B. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Sterilization requires approved equipment and process. Question 99. For a patient encounter in a same-day appointment, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Keeping sterile items above waist level. Option B. Opening the wrapper away from the body first. Option C. Using sterile forceps for sterile supplies. Option D. Reaching across the sterile field with an unsterile sleeve. The correct answer is option D. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Question 100. At the start of care in a specialty referral visit, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Pulmonary vein. Option B. Aorta. Option C. Carotid vein. Option D. Vena cava. The correct answer is option B. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart.